Hey, welcome back everybody. This is Dr. Jason Schwietz with Maplewood Chiropractic Health Center, and in this video we will be covering spinal molding. Now, spinal molding is going to be the very last exercise that you will perform, and I would like to have you try to perform this at nighttime before you go to bed, or even while you're sleeping actually. So to do the spinal molding, again, what you should have received from me is a couple foam tubes that look exactly like these two right here. Again, these are just a couple pool noodles that are very effective. You could use these at home. In fact, if you had some, you could cut them up as well. We cut them into about a foot-long section here. That's what this is. But with spinal molding, all you're going to do is simply place these underneath your spine and lay on them. It's very easy to do this. The rule here is that you're going to want to know where to place them. So there's going to be two spots. With one of your tubes, you're going to want to place it pretty much right across your shoulder line, right about here, so that when you're laying on it, your head will actually kind of fall back like that. Because if you'll recall, one of the things that we want to try to do is work on the curvature of your neck. We want to keep that curve nice and healthy. A lot of you that are getting care in the office, you've lost some of that curve. You may have lost the entire curve. Some of you might have a really bad spine where it's actually curving backwards. We have seen those quite often. So again, very simply, you just put the one for your neck right across your shoulder line so that your head can fall back. The other tube, again, what you're going to want to do is put that in your lumbar spine or your lower back. Now, a point of reference for that would be your belly button. That's what I'd recommend. Find the top of your belly button, maybe find the top of your pelvic crests, and that's where your second tube will go. So for me, I'm going to have to step back so you can see me here, but this is where it's going to go. I want it to go somewhere in my low back. And so when it's set up, you're going to be laying, again, flat on your back. And I would recommend, laying down somewhere that's comfortable first, but not too cushiony, so you're not sinking into like a mattress or a water bed or something like that. But I want to have you be comfortable. And again, you're going to have one of those tubes underneath your neck, the other one underneath the low back. And all you got to do is lay there. It's really simple. Try to lay there for 10 or 15 or 20 minutes at nighttime, and it can be very effective to take a lot of the stress out of your spine. Doing this for longer periods of time, the reason it's called spinal molding is that's what we're trying to do. We're trying to mold your spine. We're basically trying to help support the lumbar and cervical curvatures. And so again, that's why I would encourage you, after you're familiar with this process, try to do it overnight. I have a lot of patients that literally just sleep on these two tubes and that's it. And it sounds probably pretty crazy to some of you, but it's really the best position for your spine. We get into that conversation all the time. What's the best place to sleep? Best position, best pillow. Really, it's not some $80 to $90 fancy pillow you need to buy. Simply, if you can lay flat on your back with both your neck and low back curves supported, that's going to be the best position for you to sleep in. One way that it might be easier for you to try to accomplish this, sleeping on your pads that is put the pads in place, try to fall asleep. When it becomes too uncomfortable to bear, you can take the pads out, put them on the ground, and just go back to your pillow. Some of you may last for a few hours, some of you might even last all night, but the more that you lay on those tubes, the better off you'll be. So again, this has been the spinal molding video. I hope that you found it helpful. Again, if there's any comments or questions at all, please leave the comment or question below, and we'll be happy to try to answer it. And again, thank you for watching the video, and we'll see you at the next video.